I have said it then and I'll say it again. Politics is killing health. It has borne out in the fact that many of those who supported me back then in my quest for a better public health system are now my most vitriolic accusers and critics, when my motive has not changed, whether this administration or a PNP administration. We know that there are truths and lies, and in politics there is the truth, there are lies, and then you have to look at clarity. And truth without clarity breeds the proliferation of lies. We have made a claim that has been rebutted, that there is a shortage of ICU spaces or intensive care unit spaces in the public health system. And that has been rebutted with the declaration that there are varying numbers of ventilators that we asked specifically about in the public health sector. We're seeing numbers such as 122 ventilators, 105, 150, and one press release counting 54, including the University Hospital of the West Indies, which is not a part of the public health system. We know for a fact that many of these ventilators that were donated during COVID as a result of the efforts of the European Union and several private sector organization entities, as well as well-thinking Jamaicans, these ventilators are not in working order. For example, the Kingston Public Hospital, which is the main referral hospital in Jamaica, has a maximum of 8 working ventilators. Now, it's not hard to find 105 ventilators, and if you subtract 8 from that, that means you have 97 to be distributed to lesser upgraded and developed hospitals. So we know that many of these ventilators are in boxes, they're not commissioned, or they have been cannibalized, where one part has been taken from a ventilator to fix another ventilator that is not working. So we know this for a fact, that the donated ventilators are not operational. So we are seeing what can be described as fuzzy maths, where we do not know exactly how many are operational. I cannot tell you how many. The Minister of Health and Wellness cannot tell you. What we need is an audit to see exactly how many ventilators are available island-wide and how many actual ICU spaces and HDU spaces, or high-dependency units, which are a step down from ICUs. How many of these units are available island-wide for Jamaicans who need critical care? Now, we have been focusing a lot on the donated ventilators during the time of COVID. What is disturbing is that we should not have been in a space where we were battling to get ICU spaces, especially for mothers and infants, because of a program that was conceptualized just about 10 years ago, the PROMAC program. So the EU gave money then, and the EU gave money again during COVID, along with other Jamaican entities and individuals. And we are still left in a situation where there's a dire shortage of intensive care unit beds and high dependency unit beds for adults and neonates. So the stories that we are seeing are not unexpected, because they reflect a systematic issue. And a big part of that systematic problem is that we have a maintenance issue and we have accountability issues. Now, the aims of the PROMAC program to decrease maternal and child mortality rates have failed because of some other, maybe other incidents or other contributing factors. But the fact of the matter is that over the last 8 years, we have seen a steady climb in the number of mothers dying during pregnancy and delivery. The maternal mortality rate is the highest it has been in over 30 years. The neonatal mortality rate is higher today than it was 20 years ago. The number of children under age 5 who are dying is higher than it was 20 years ago. So there are measurable consequences for the failure to implement and maintain an adequate healthcare system. What this boils down to is not a money issue. If we look at the health budget today, it is almost triple what it was 8 years ago at the conceptualization of, 10 years ago at the conceptualization of PROMAC. It is a matter of priorities. It is a matter of policies, and it is a matter of the proposed solutions. Having identified that there is a maintenance issue, and there is a maintenance unit at the Ministry of Health, the Health Facilities Management Unit, instead of building the capacity, increasing the number of biomedical engineers, increasing training, getting a proper preventative maintenance program, having spare parts so you don't have to raid one machine to fix another. What we have seen is a tendency towards outsourcing, whether it is diagnostics or treatment, without the building of the capacity. And so money will be spent out, but the health sector is no better off than it was after a massive spend. That has to change. We do have many hard workers in the public health sector who just want the right tools and the right support, whether it is training opportunities or just adequate staff. That is where our priorities should lie. Instead, we are divided. And I must say, politics, I said it years ago as, maybe my last press conference of this nature, when I was president of the Jamaica Medical Doctors Association. I have said it then and I'll say it again. Politics is killing health. It has borne out in the fact that many of those who supported me back then in my quest for a better public health system are now my most vitriolic accusers and critics, when my motive has not changed, whether this administration or a PNP administration. The fact of the matter is that we're all Jamaicans. If we're not going anywhere, or even if you do have relatives here who are at the mercy of a good or bad public health system. Those who would like to see us divided along political lines, they have their own routes for getting adequate health care. Many of us who are fighting on social media do not. We have to be united in our demands, whether it is through this administration or after elections. If I am sitting in that role, the demands must be kept up, that nothing short of an overhaul of our public health system is the only way forward for all well-thinking Jamaicans. So there are proposals out there. I will not reinvent the wheel, but there are many proposals, green papers, white papers, languishing in the Ministry of Health right now, just begging for implementation, begging for prioritization. And until we do so, we will be left with horror stories, because the broken system is going to continue to produce horror stories. Jamaicans are getting sicker and sicker. We have more diabetics, more hypertensives, more people with chronic diseases, an aging population, and all of these increase the burden on our public health facilities. If we're not seeing significant improvements to keep up with the rate of increases in these chronic diseases and the aging population, we're going to reach a crisis level. And unfortunately, if we continue along the road that we're taking, that crisis level will be fairly soon. We may be just one natural disaster, God forbid another pandemic away. But as it is right now, our public health system is no better to the end user. It is no better using the international metrics, such as maternal and infant mortality rates, than it was 10 years ago. So money is not the problem. Will and the demands of the Jamaican people for accountability are the problem. And until we step up our demands for better health care, the political will not manifest.